We are meeting with the Catholic HIV and AIDS Network, and it's a group, it's a network of organizations that have very much engagement in responding to the pandemic of HIV and AIDS throughout the world. A number of the representatives in this group are either sponsoring HIV and AIDS programs, education, services, care and support for people living with AIDS and those who have been affected by AIDS in general in many countries throughout the world. Or they are involved in giving support to those programs, especially in the developing countries. The Catholic Church, according to statistics that have been presented by the Vatican's Pontifical Council on Healthcare, is responsible for about 25% of all AIDS care in the world. And it's important for Catholic organizations doing this work to come together to share their experiences and also to learn from each other and also share their challenges so that they could support each other on this. And the purpose of this network is really to give support to Catholic organizations.
Well, I think the biggest challenge we're all facing as the time goes on is that the developed world has been tremendous in giving help and support, especially for care and treatment for AIDS patients. But we all know with the Great Recession and the impact that had around the world as far as funding and money goes, it's also had a great impact on people that are working on the ground with HIV and AIDS. And whether you're one of the donor groups, like here, some of the agencies here today, or myself are on the ground, we've been aware that our budgets are getting cut, they're getting are being frozen, which is the same as a cut. And it's not a question that you're not doing good work, it's the economics of the time. And I guess our concern long term is as the money slowly begins to dry up, what's going to happen to the patients?
The overall feeling is that HIV/AIDS is not an alarming issue anymore, therefore there's no need to continue to support, which in fact is a problem. And this affects our work in many ways. We find ourselves in situations whereby we have to leave things pending, unfinished job kind of. So there's always need to continue to support and so that support the work that we are doing, so that we can be sure that the work we are going to do can have a long-term effect. If we stop now, we are going to go back and have to put more money in the next years to come.
Since 2007, Caritas Internationalis has been working on a campaign on pediatric AIDS and pediatric tuberculosis. So during each CHAN, Catholic HIV and AIDS Network meeting, we look at the issue of pediatric AIDS. We see what are the challenges and what are the updates. The campaign of Caritas was launched in 2009, which is the year that celebrates the 20th anniversary of the Convention on the Rights of the Child. And the title of the campaign is Heart for Children. And we played with the word heart. Heart is the name of the medication that are given to the children living with HIV and to the people who are living with HIV. The campaign was meant to advocate for promoting access to medicine for children living with HIV, for children living with HIV and tuberculosis, and for the scale-up of program for the prevention of mother-to-child transmission of HIV.
At this point, there is no cure to AIDS, but we do have special antiretroviral medications that when they're used in combination, they're very effective for most people to keep the level of virus in their blood down, and therefore to keep their immune system stronger and to help them to fight against the many different diseases that are part of AIDS and that are responsible for the death of people with AIDS when they don't have that treatment. And so right now, throughout the world, we have fewer deaths due to AIDS, and we even have fewer people becoming infected, because when infected people are on these medications, then they're less likely to spread the virus, especially through sexual means or from mother to child. And so the more people we have on treatment, the better prevention we have as well. And it's a very effective prevention. When people are on treatment and they stay on treatment, they're 96% less likely to spread the virus, even to their intimate partners. And that's extremely effective. You know, for years we had a debate in the international community about condom use, and many times the church was attacked because it did not promote this means of prevention. And yet the effectiveness of treatment is much higher than the use of condoms.